We've recognized over the last few years that comorbidity is very common in people with multiple sclerosis, and as we've started to explore the effects of that, we have determined that they're pretty wide-ranging. So if we consider the diagnostic period for people with MS, individuals who already have a coexisting health condition experience longer delays between symptom onset and diagnosis, which is obviously important given that we know that early treatment is more effective. And then once the disease is established, we know that individuals who have a higher burden of coexisting illness, particularly the vascular risk factors like diabetes, high blood pressure, heart disease, as well as depression and anxiety, experience more rapid progression of their disability. So this then sort of raises some questions about treatment, and one of the things that we have found is that as the number of chronic conditions people have increases, the less likely they are to even start a disease-modifying therapy, and they may be less likely to remain on that therapy. Some data from Italy suggests that they're less likely to tolerate a therapy, and so that they may not persist as well because of that. And so that has some important implications for helping people make decisions about treatment and remaining on it. In an even more complex way, the other issue, of course, is that some of our disease-modifying therapies increase the likelihood that you will develop a comorbid condition, and some comorbid conditions are contraindications to using a therapy. So as a clinician trying to help an individual with MS make decisions about their treatment, you really have to be thinking very carefully about all aspects of that individual, not just the characteristics of their MS, but their comorbid health conditions, so that you can make a choice that is safe and effective, and then find a way to support that individual to remain on therapy. This is an area that's sort of rapidly emerging, and so I think we'll likely learn more about the effects of comorbidities over time, including whether or not we need to treat them differently in people with MS. So do we need to be more aggressive about identifying these conditions, treating them more aggressively, figuring out the best models for ensuring that all of these issues are addressed. And so hopefully we'll do a better job with some of these issues moving forward. In terms of future work, one of the things we're starting to look at now is to try and look at the reverse of the direction that we've been doing before. So a lot of our work to date has been, how does having a comorbid condition affect MS? So now we really need to understand how MS affects the diagnosis and treatment of coexisting health conditions, so that we can then really figure out what is the best way that we can optimize the care of those conditions. And so we all have different perspectives, so now we need to sort of turn and look at it from the perspective of the other conditions and the other healthcare providers to figure out what they're seeing and doing, so we can then hopefully all come together to figure out what the best approach is.